To Britain now, and Queen Elizabeth has tested positive for COVID-19. She's received 3 doses of a vaccine against the disease. Buckingham Palace says the monarch has mild, cold-like symptoms and will continue with light duties in the coming weeks. The Queen had met with her son, Prince Charles, just days before he tested positive for the virus early in February.
Many congratulations on the start of your...
DW correspondent Birgit Maas is following that story for us in London. Birgit, how is Queen Elizabeth handling the infection so far?
As usual, Buckingham Palace is not giving a running commentary on the Queen's health, on any monarch's health. We know that she is in Windsor and she's said to have only light symptoms. On social media, it's been reported that there is a wider outbreak of staff of COVID in Windsor, but that's not something that Buckingham Palace has confirmed. However, we do know that she had met with Prince Charles and Camilla, who both had tested positive of COVID. But as for now, we only know that she is continuing to have mild symptoms and doesn't want to give up work, remarkably.
Which typically for her, of course. But let's not forget the monarch is 95 years old and she's had health issues over the last couple of months. How are the people in the United Kingdom reacting to the news?
Well, absolutely. She is 95 and as such, she is more vulnerable, even though the Omicron variant is lighter, but older people are more vulnerable even if they are vaccinated, as she has been. I think a lot of people will be relieved that the symptoms appear to be mild, but I think it does put a spotlight on the government's policy that we still have tens of thousands of people getting infected with Omicron every day. However, there are virtually no restrictions, and Boris Johnson is even announcing that in the very near future, in the next days, he intends to lift the obligation for British people to self-isolate if they do test positive, and also testing will not be as widely available as it is at present. So I think the monarch's illness at this age of 95 puts a spotlight on the government's policy, and people will be asking whether this is really the right strategy.
All right, thank you, Birgit Maas in London.